So now you know the process of gaseous exchange, both at rest and in exercise. We just need to be able to translate that to some potential issues we might face whilst being or even exercising at altitude. And similarly, how altitude might be helpful to us in terms of a training situation. So, specification says you need to be able to explain the effect of altitude on the respiratory system and how it influences the performance of different intensities of physical activity, so different kinds of physical activity. Now, you might be able to see quite clearly here that as we move up from sea level, the percentage of oxygen in the atmosphere drops. So whilst we have plenty of oxygen available to us in the air and therefore into our bodies, at sea level, as we increase in feet or meters, the percentage available drops, and that's quite critical to looking at the effect of altitude on our performance in physical activity. Now, what specifically is the issue with altitude? We actually would experience what we call hypoxia or hypoxic conditions, and that means hypo means under or less than. So this basically is meaning that at altitude there is a lower partial pressure of oxygen in the atmosphere. The air is thinner and the amount of oxygen available to you is reduced. Now this could be from sea level, we might have maybe 159 as a value of partial pressure of oxygen, millimeters of mercury, but at altitude it might be as little as 50. So there's quite a significant drop in the partial pressure of oxygen at altitude compared to at sea level. From the table I showed you previously, you can perhaps understand that the amount of oxygen in the air is proportional to the altitude you're at, i.e. the higher you go, the less oxygen is available. It's inversely proportional. And obviously that's going to have implications for your respiratory system. Your respiratory system's not going to be able to do its job as well. External respiration is going to be limited, internal respiration is going to be limited. So ultimately your ability to perform physical activity at altitude will negatively be affected by this. Now remember, gaseous exchange and diffusion in particular is all about the diffusion gradient, the fact that there's a higher partial pressure and a lower partial pressure, and the steepness of this gradient, so in this analogy how steep the slope is or the slide is, will determine how much oxygen or gas moves from one place to the other. So ideally we want a reasonable gradient so that gas moves from one place to the other, like so. High and a low concentration, and it's all about the gradient for gases to move. Now, what we've got at sea level is we've got a high partial pressure of oxygen in the atmosphere, so we've got plenty of oxygen in the atmosphere that gets into our alveoli, and that creates a sufficient diffusion gradient so that the oxygen from the atmosphere goes into our alveoli and diffuses happily into our blood. And then we know that the oxygen associates or joins onto or combines with hemoglobin, and the hemoglobin leaves the alveoli going off round our body in our blood fully saturated. So that's quite a positive situation. We have enough oxygen in the atmosphere and ultimately our hemoglobin leaves the lungs totally topped up with oxygen. So let's just look at what actually happens in altitude. Now, we actually have a lower partial pressure of oxygen in the atmosphere, which means that there's going to be less in the alveoli. And the consequence of that is that there's a shallower gradient between the atmosphere and the alveoli. Less gets into the alveoli, which means that there's going to be less in the alveoli to create a diffusion gradient between the alveoli and the capillaries. So this smaller or shallower diffusion gradient means less oxygen will move from the lungs into the blood and less oxygen will associate with hemoglobin. So instead of leaving fully saturated, the hemoglobin is less saturated at altitude. And if the blood is circulating around the body and heading to our muscles and it is less saturated, When it arrives at the muscles, there'll again be a lower diffusion gradient at the muscle site. So less oxygen will dissociate from the haemoglobin and diffuse into the muscles to be available for exercise. So in summary, because we've got a lower partial pressure of oxygen in the atmosphere, there's less that gets into the alveoli, and there's a shallower diffusion gradient at the alveoli in the blood. There's insufficient oxygen, or less oxygen diffuses into the capillaries and associates with haemoglobin. So haemoglobin actually leaves the alveoli less saturated. The follow-on story, as I said, when we arrive at the muscles, is that the blood arriving at the muscles has a low partial pressure. It's not as saturated with oxygen. Therefore, there's a low or poor or shallow diffusion gradient between the blood and the muscles. There's insufficient oxygen that can diffuse, therefore, into the muscles. And if our muscles are not getting lots of oxygen, they essentially can't work aerobically very well. So there's a lower VO2, and this VO2 means the volume of oxygen our muscles use per minute. If we're not getting lots of oxygen in, it can't be used per minute. Now, this graph really represents all of that. So we've got 0 to 10,000 meters increasing altitude. Now let's just look at the red one first, oxygen in the air. So at sea level, we have lots of oxygen in the atmosphere, and as we increase altitude, there's lower and lower and lower and lower partial pressures of oxygen. This axis is the level of oxygen in the blood, so the percentage saturation of haemoglobin. Now, at sea level, here you can see that the haemoglobin is practically fully saturated. But as we increase in altitude, you can see the blue line also drops. So as we increase in altitude, our haemoglobin leaves, or the oxygen in our blood gets less and less and less and less and less, to the point where at 9,000 meters, it's only about 63.4% saturated, as opposed to 100% saturated at sea level. So again, there's a graph representation of the consequences of altitude. Now, our body obviously isn't happy to have less oxygen available, and it does a couple of things to try to compensate for that. One is hyperventilation, which hypo meant less than or under. Hyper means more than. So if you're increasing more your ventilation levels or rate, you're basically breathing much more rapidly. The other thing that occurs is tachycardia, and this is an increase in heart rate, so your heart beats faster, both of which are trying to compensate for less oxygen coming in to the body. And if we can circulate blood faster and try to breathe faster, we can perhaps try to get more in. It's obviously not that effective, but it's our body's way of doing that. And here's actually an image to show normal breathing, and the lighter, reddier colours show oxygen saturation in the brain. So you can see here normal breathing, we get plenty of oxygen to the brain. When you're hyperventilating, you can see it's much darker, which means that not as much oxygen is actually getting into the brain, and that's not a good thing. So the drop in partial pressure of oxygen in your blood is picked up by the chemoreceptors, is recognised, and as a result, your respiratory control centre tries to increase breathing rate, or does increase breathing rate a lot, and that's called hyperventilation. One other thing that might be relevant is that where there's a lower air temperature at altitude, you might lose more water, you might be at greater risk of dehydrating, which obviously isn't going to be good for your performance also. Similarly, another sort of response to being at altitude, let alone whether you're exercising or not, is altitude sickness. So you can see here some really unpleasant sort of side effects of being at altitude, and obviously that's not going to help you feel brilliant, let alone want to do some exercise. So some consequences of exercising at altitude. You will fatigue earlier, so you'll build up more lactic acid earlier in your bout of exercise because you can't work aerobically very well, and you're almost forced to work anaerobically And obviously, the more you work anaerobically, the more lactic acid you build up. So this is the fatiguing factor. The more lactic acid you build up, the earlier you'll fatigue. And obviously, when you fatigue, your performance deteriorates. And as we've explained already, there will be a reduction in your aerobic capacity, how well you can use oxygen, and ultimately a drop in your VO2 max, the maximum volume of oxygen you can use per minute with your muscles. And that's not going to help you perform aerobically. But some people clearly seek to train at altitude, and let's just look at why that might be beneficial. When you're in those hypoxic conditions, your body will suffer a little bit to start with, but it will desperately try to adapt to cope. And one of its responses is to produce more EPO, which is called erythropoietin. It's a hormone which makes more red blood cells and ultimately then hemoglobin. So this will allow you to carry more oxygen around your body. Also, you'll produce more capillaries, which again is better for gaseous exchange. Now, with those adaptations to your body, after a few weeks when you return to sea level, you'll have a greater oxygen carrying potential. With the hemoglobin and with the more capillaries, you'll basically be able to transport around and use more oxygen per minute, and that's obviously a massive advantage to endurance events. So very, very quickly, the acclimatization process. When you first arrive at altitude, you feel awful, your fitness will drop, you'll struggle for all those reasons we've mentioned. After a period of time, you begin to acclimatize and kind of get used to it. So you make some physiological adjustments. You still might find things tough, sort of your fitness level isn't quite there yet, and at altitude you'll still struggle. But when you return to sea level here, you'll find you have all those advantages, more red blood cells, better lung capacity, and you'll be better at endurance events. And that advantage can last for a few weeks on return. So do pause the video and have a look at these advantages and disadvantages of altitude training. Obviously the physiological advantages there, and some other factors which aren't so positive or suitable. Now, does altitude affect all types of physical activity or intensities of physical activity the same? Let's have a look. Mexico Olympics was held at nearly 2,500 meters above sea level, and what they found was that the anaerobic events like the long jump, 100 meters, 400 meters, all hit world records which lasted for years and years and years. Whereas the aerobic events, those that needed obviously endurance events, people really struggled, except for African runners who typically come from countries where they are at high altitude, and they excelled in these events, whereas all those that didn't live at altitude really struggled at in altitude to perform very well. So that's a really sort of good example of the effect of altitude on anaerobic versus aerobic events. Training anaerobically at altitude has no necessary significant benefits, although there's always sort of slightly conflicting research. Although performance might be a bit better, partly because the air is thinner, and essentially running through there, or any projectiles going through the air, there's less resistance. So sometimes it can be helpful. And some anaerobic events might suffer from a quicker buildup of lactic acid, which obviously is going to deteriorate their performance. In terms of altitude training, there are three versions of how to go about this. Live high, train high. So you spend all your time at altitude. You will struggle a little bit with the intensity of training at altitude. So this isn't really considered the best way. Then you can create hypoxic environments where essentially you simulate altitude, or maybe you travel up to somewhere of a higher region to do your training. But again, there's mixed results as to whether this is beneficial. And actually, when you're trying to train in high altitude situations, you'll find you can't essentially work as hard, and this can almost be counterproductive. So then we've got simulated hypoxia, so hypoxic chambers or altitude tents. or things sort of tents which you might sleep in. So you train in normal sea level conditions and perhaps sleep in altitude tents. So live high, train low is the best outcome.